Well, one Newport Beach doctor has spent a decade researching fibroids, which impact 171 million women globally. Our Amy Paffrath is here to share how his work is impacting policy in Washington. Amy, good morning to you.
Good morning.
Good morning, Melvin. Good morning, Giselle. Well, Dr. Steve Yu told me that uterine fibroids are extremely prevalent, but that doesn't mean the condition is normal, and millions of women are needlessly suffering. The doctor's years of research has caught the attention of policymakers all the way in Washington in an effort to save women's reproductive organs and help them have the best quality of life at any age.
The mother-daughter bond is unlike any other. Sydney Gonzalez has always encouraged her daughter, Samantha Conway, to speak up for herself.
I talked to her about everything from being a girl to becoming a woman to becoming sexually active to caring for herself and respecting her body.
Accustomed to listening to her mother, Sam once again sought her advice at age 22 after being diagnosed with cervical dysplasia. Her doctor wanted to perform a surgery known as a LEAP procedure.
I didn't think she was quite ready to experience something like that at 22 years of age.
She decided to get a second opinion, one that took her from Simi Valley to Santa Monica.
He was worth every single second spent in the 405 nightmare, worth all of it.
Worth it because Dr. Steve Yu saved her from having a major surgery with lasting repercussions, including early menopause. Dr. Yu didn't set out to become a champion for women's health, but he couldn't deny what he learned in med school.
An astonishing fact is there's over 600,000 hysterectomies that are being performed annually just here in the United States. In my opinion, most of those hysterectomies can be avoided. Women have been mistreated when it comes to gynecologic surgery care.
The Hawaiian Gardens-born physician has been practicing for over 20 years. He doesn't care if he's a patient's first stop. He just wants to be their last.
They come to me their second or third opinion.
Including Sydney. She saw the doctor herself when she couldn't get a straight answer elsewhere for her mysterious 3-month-long period.
I just started feeling like there was something seriously wrong.
All my patients get an ultrasound.
Those ultrasounds help Dr. Yu catch things other doctors miss, like Sydney's cyst, which did need to be surgically removed. Though she and her daughter have both experienced frustration with the medical system, her work as a nurse makes her compassionate for the profession.
A lot of them just don't have the time. They don't have the manpower to be able to see all these people. And that's what's costing us a lot of lives.
Saving women's lives is why Dr. Steve spent a decade at UCLA researching uterine fibroids, something he says affects 70% of women over the age of 50. His office was even consulted by then Senator Kamala Harris, who recently introduced a $30 million bill for women's health.
I can't take credit for the bill. I think the bill was passed because our vice president is passionate about women's health care.
But like the VP, Sam and Sydney urge women to advocate for themselves.
If you think there's something wrong, if you feel like there's something wrong, then there's something wrong, and to follow through with that. Even if you have to fight for it, it's worth it. We're all worth it.
When it comes to women's health, it's what's on the inside that counts.
And that bill that Kamala Harris recently introduced would allocate $30 million for Black maternal health, as well as fibroid research, as it disproportionately affects Black women and childbearing ability.
This is a great story, Amy, as always. So what can people do to show their support for Fibroid Awareness Month?
Right, it's certainly an important story to get out there. There's the White Dress Project. That's a movement of women who suffer from fibroids, which often comes with heavy bleeding, so they're afraid to wear the color white. So they're reclaiming that color as a powerful statement. But of course, the biggest statement you can make is speaking up for yourself and asking your doctor, getting a second opinion if something doesn't sit right. If you want to find out more, you can check out thewhitedressproject.com.
So important to bring it out in the forefront. Thank you so much, Amy, as always. Great job. We'll be back.